please, can you go to your recommendation? Because
the recommendation is broken into complexes. One for the National Association of Community Health Practitioners and the professionals. So we advocate for intensified advocacy for the government through the Community Health Association of Nigeria. Then mentorship program like the one WESLEY is doing. So community professionals should continue to support the incoming professionals so that they will be more mentored to face the more challenges of the burden.
thank you. We just have a limited time. Please, thank you. Any question? Question for him? Contribution? But I just have one question. Just one question. How many objectives do you have?
5 objectives, sir.
And how many recommendations?
The recommendations are broken for the community health, for the Association of Community Health Practitioners, then for the Lagos State Primary Health Care Board as a board that supervises health care system in Lagos State,
Now,
and for the entire community.
now, from this your recommendation, you just have 2 recommendations. Part 1 and part 2, 2 recommendations. That is it. But you see, if you are writing a recommendation like this, you have 5 objectives, 5 research questions. Your findings should be 5. Then your recommendation should also be 5 based on your findings. Findings number 1, we'll go for the, let's say, objective number 1. We'll go for question number 1. Then findings number 1 and recommendation number 1. That is how it continue to flow. Do you understand? So please take note. Whether you are going to collapse them together, to get 5 points based on your objective. Thank you. Any other? Thank you, presenter. Please, a round of applause for him. I've just been told that we still have more presenters. How many of you do want to present? How many of? Please let us know. Just one person. Mommy, did you see? Where are they? 2. You can see now we cannot break it. 11. Where are they? No. What? I don't want us to get from. No. Let us break them. If you are many, if you are not many, let's continue with this way. Number 11. Emmanuel Saint Ama. Oh, amen. Please clap for him. Let us appreciate each other.
Please permit me to stand on the existing protocol. My name is Emmanuel Saint Ame. I'm here to present a paper titled Sedentary Lifestyle and Health Outcomes Among Civil Servants in Ondo West Local Government Area, Ondo State. Implications for community health in a globalized society. Sedentary lifestyle has become a major public health concern globally. Among civil servants, work activities are largely desk-based, involving long hours of sitting, computer use, and meetings. This trend is worsened by digitalization and office automation. Statement of the problem. the problem addressed in this study is the growing exposure of civil servants to prolonged sitting and inactivity. Despite known health, limited empirical evidence use the descriptive cross-sectional design. And this is important because it allows data collection at a single point in time. The sample size for this study is 100 servants. Now, let's look at the key results. 64% of the respondents were females, 75 were males, and the tertiary and postgraduate respondents were 64%, administrative sector 54%. This result shows that the majority of respondents were female, married, and highly educated. Most were senior in administrative roles, suggesting a desk-bound workforce. Let's look at the results for sedentary behavior. But the major finding here is that 67% of the respondents had a high sedentary lifestyle level, indicating a widespread occupational health outcome. Hypothesis testing. Chi-square result. My p-value is less than 0.05. So the chi-square analysis revealed a statistically significant level and sedentary lifestyle. This means social demographic characteristics significantly influence sedentary behavior. Conclusion. In conclusion, the study established that sedentary behavior is highly prevalent among civil servants in ONDO West local government area, with important implications for health and productivity. Recommendations. The study recommends that there should be workplace health education, movement of breaks. There should be exercise and wellness programs among civil servants. So, occupational health policy, reduced prolonged sitting, and targeted staff interventions. Thank you very much.
Thank you very much for your part. You manage your time very well. Thank you very much. Any question? Contribute.
Good afternoon, Mr. Presenter. I just want to ask a question so that at least each and every one of us that is here, we have a take home. Based on your research now, what is the key take home in 2 or 3 ways that will benefit each and every one of us that is seated here from this your research? Do you get the question? You get the question?
There is an associated health risk that is involved in sedentary lifestyle, and that's the state like obesity, hypertension, and so on. Now, the take home for this study is embedded in the conclusion and the recommendation. Like I said there should be established sedentary behavior, right, that should be prevalent among civil servants in ONDO West, right, and so that's it. And then the recommendation, I said that there should be, I gave 6 recommendations, and one of them is there should be workplace health intervention, education, and so on.
Okay. Any other question? Now, my presenter, you have 6 objectives. If you want to write a thesis, how many objectives are you going to have? When you are writing a conference paper, you have 6 objectives, and you want to pre-write what do you call it? Thesis, whether masters or PhD. How many objectives? Yes, answer.
It's just a major, just like a main objective, just splitted to that to make it simple. and it was they were explained and explicitly to you.
Well, but just think about it. Think about it. Please, allow that the online is ready. Please, let's take one of them. Over to you, technicians. It's on, right? Over to you, the presenter online. Just 5 minutes. Probably your introduction, 1 minute. Your literature review, 1 minute. Methodology, 1 minute. Recommendation, 1 minute. Making 5 minutes, please. Thank you. Over to you.
Já sọ̀rọ̀ yín gbọ́n mi lọ sí ìjọ yín kíní ìpadà.
Over to you, the presenter online. Just 5 minutes. Probably your introduction, 1 minute. Your literature review, 1 minute. Methodology, 1 minute.
Wọ́n fi pàrọ̀ lẹ́kì lẹ́yìn tí. Ìwé abstract nǹkan wà fà mí. Ìgbọ́n kan ní ìgbọ́n náà ti. Òkè bí a kì í ṣe báyìí, bí a kì í send paper yẹn sí ọ̀kí ló fún mi. Okay, done. Allow me already. Okay. Hello. 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 Hello.
Hello, we are with you. We are hearing you.
Hello. 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 Good afternoon, sir.
Hello? Can you hear me? Can you hear me? Hello? Hello, let us continue with our physical, please. Yes. Who is the next person? Let's continue with our physical. We cannot be waiting. What's the name?
Where
Network problem.
that you talk. If
I'm
you
a
can hear me.
presenter. Am I free to present
Hello, you are free.
now?
You are free to present.
Go ahead, but I don't know if yes.
Please, online. Somelewa, who is Somelewa? Please, be on. Come and present.
So
You are okay. Present. Sorry.
Just come up, come up, come up.
so
You are okay. Present. Sorry.
Standing on the existing protocols,
Come up, come up,
existing protocols,
come up, come up.
existing protocols, existing- standing on the existing protocols, my name is Omoloa Patience Odun. I want to present on the paper titled Sedentary Lifestyle, a Contributing Factors and Health Outcomes Among Civil Servants. That is health, what are the health implications? Then what are this sedentary lifestyle has become a significant public health challenge globally among the middle and the low income countries. And what this research, the aims and objectives, then the problem, the statement of problem, we say that sedentary lifestyle is an increasing public health concern, especially among civil servants who work involving prolonged sitting and low physical activities. A lot of people sit for long time, especially maybe in the aspect of those that are in the administrative, they sit a long time and they don't even know the implications of prolonged sitting. And that is why this research is being done for us to give an awareness for our civil servants, for those that are working on in the offices, maybe those people that sit for 6 hours, 8 hours, telling them the implications that if they should be aware that sitting long can cause a lot of health challenges in our body system. So that is why this research is being done. And then what are the objectives? To examine sedentary lifestyle, its contributing factors and association health outcome among civil servants in ONDO, and then to also assess the social demographic, the prevalence pattern of sedentary behavior, and then the contributing factors. Then what does the hypothesis? We see that there is no significant relationship existing between social demographic characteristics and the sedentary lifestyle. Also, association between, there is no significant association existing between contributing factor and sedentary lifestyle. Now, going to the design, a study area, we say that a descriptive cross-sectional design was used within the ONDO West local government, and then the population, we see that population we use include between age 18 years and above, so that we'll be able to get our responses. And then from the sample size, data collection, it was being collected using a structured interview, and then we also went the procedure. We went with our weighing scale, the height, so that we'll be able to check the BMI. This BMI will help us to know the kind of the category, whether they are normal or they are maybe they are overweight, they are maybe obese, so that to be able to know the outcome of this sitting, of this sedentary lifestyle. So now our take home, what is our take home? The essence of this study is that to make us aware that prolonged sitting, it causes more harm than good. And then we should also, while in the office, maybe you see that you have a lot of workload, just stand up, just walk around, and then if it is to stretch your hand, just to make sure that your at least your blood is circulating. And then from our result, we find out that the social demographic characteristics, so that most respondents were middle age, between 40 to 59, female married, and with a majority being senior staff and administrative workers. So we notice that this sedentary life, in fact, it happens majorly among the administrative workers, and it refers sedentary occupation. Then let me go to my conclusion. The study concludes that sedentary lifestyle is highly prevalent among civil servants, largely driven by occupational and organizational factors rather than individual
factors and sedentary lifestyle outcome, leading health implication that you identify in your study. Because you have many people here in ONDO that are ready to go and swing into action, we need to prioritize. At least you need to highlight the cases you identify among the senior civil servants among your subjects. Someone like myself, I am used to the exposure you have just stated, and I am around that age group. So it means I may be liable to that condition. So I will also start strategizing preventive measures in order not to get stuck in what my predecessors were identified in. Thank you.
Thank you.
Yes, I'm sorry for not outlining the health outcomes. We have, for someone that sit down for long and is exposed to obesity, that is why I said the BMI of a thing comes in. That's why we need to always check our weight, to know the level at which our weight is. And then it also causes hypertension, which is an underlying condition. And then diabetes. So if somebody is being fat, it will come with other disease conditions. That is why we need to exercise ourselves regularly for easily circulation of blood. And by the time we are not too obese or we are not too weighty, hypertension whatsoever will not have way.
Thank you. No. Where's you have spoken? We have no wait. I want somebody different, person who has not spoken before. Okay. No. No, not for present. On our own issue. Okay. Let me give it to him.
All right, good afternoon once again. The presenter, like you rightly pointed out, I was just trying to differentiate between your own and the previous presenter. That is just by the way. But my question is, I noticed that this your research is questionnaire based, right? Of the subject are more prone to the effect, or would I call it side effect, of sedentary lifestyle. Thank you.
The study design, the sample size and techniques we use 100, and then determine, though we assume the number, because what we're targeting was 100 participant responses, and then we use a formula to calculate that to arrive, and our assumed Then, like I said, the data collection stream was also collected using structured, interviewed, administered questionnaire, where we went out, we gave them the questionnaire, and then we also interviewed them, getting a response.
Thank you very much. Thank you very much. Thank you for my brother here for his observation. You can go and sit down. You know, we have already observed it that the presenters have the same topic, and that will be taking note. We have taken note of that. Yes. Is it on this? No?